The hashtag EndSARS protest in the southern parts of Nigeria and its close variants, the hashtag #EndInsecurity now in the streets of the north, have been unfolding for the past 2 weeks without any strict observance of safety protocols on COVID-19 by protesters. Remarkably, the Presidential Task Force on COVID-19, headed by the Secretary to the Government of the Federation, Boss Mustafa, had shortly before the protesters warned Nigerians to be on alert for possible resurgence of active COVID-19 cases. And right on cue, the Lagos State Commissioner for Health, Professor Akin Jimoh, a few days after, broke the alarm about a new 181 students of a private school in Lagos contracting the virus. Have the alarm bells been loud enough? Well, for introspection on this, we are being joined by Akin Jimoh, a medical physiologist. It's a pleasure having you. Welcome to the program, Akin Jimoh. I just want to quickly go straight to you and talk about, the protest and COVID-19. What can we make of it? Some protesters have tried to wear masks, some have not. But what can we make of all of this?
Yeah, when you look at the crisis, the agitation, you realize that a lot of the people on the protest don't wear masks. Very few. You can just see a dot of someone wearing a mask. And it's not just about this crisis alone. When you look at some of the activity that has taken place in the past, you look at burial ceremonies where people don't put on masks. You look at activities, even social activities, in the country, people are not wearing masks. You look at the recent political activities in terms of elections, electioneering campaigns, and so on and so forth. Masks were not being worn. And this leaves much to expectation. We have an issue that we're going to deal with even after this. And some of these things are being dealt with gradually. We may not know, because a lot of the time when things happen, medical experts are the last to know about it, but communities know the issues that affect, their community members, and we all need to be very careful, as we protest. We need to be very careful that we protect ourselves, not just against any violence or any other thing, but there's a silent epidemic going on amongst us, which we need to really, 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 really be careful about.
Akin Jimoh, two things. One, what do you think of the protests as a citizen? Well, I can't call you a young man anymore. I see, you belong to the older generation, but we're all involved in making Nigeria a better place. What do you think of the protests? And secondly, the point you just made, there are people who argue that, look, we have seen election campaigns in Nasarawa, in Edo State, in Ondo State, and at the time, we also expressed concern that people were not using face masks, but nobody has reported any surge in infection rates in those 3 states. And some people say, well, do we really have a high prevalence of COVID-19 in Nigeria, or it's just something that the people have accepted? It's an official thing that government talks about, whereas within communities, they don't really feel it, as say in England or in France or in Spain or the United States.
Yeah, you see, one thing we need to really realize is the fact that, there's a saying that he who wears the shoe knows where it pinches. When you are sick and you are in the hospital, you know the situation that happens to yourself. And the key thing is, we may say we are not seeing, but NCDC, research institutions, people who conduct key researches have an idea of what the incidence is. They have an idea of what the prevalence is. They have an idea of what are the things happening within our society. The information may not have gotten to us, but the key thing is this: something is happening silently. And when you talk about what I feel about the crisis, remember June 12th. Remember the time that the country was locked down. Remember that we were on the street those days, counting dead bodies, counting the number of people wounded. So this is something we are used to. And for me, I do tell people that I feel we are not being led by leaders. We are being led by rulers. Rulers that say that, look, this is what we have to do, and we have to do it the way we want it, and so on and so forth. And it's very good. I mean, I'm very happy that young people that I used to look at as, look, these people are docile, they don't know what they want to do and all the other. Young people are taking up the challenge because it affects them. If you pass through the university, you come out, you don't have a job for 5 years, 6 years, 7 years, 10 years, and so on and so forth, what do? You continue just sitting down and looking and counting the ceiling. And this is an indication that our young people are very active. Our young people are not docile, but we need to take precaution. You are a young person. It may not be apparent that the virus or you get sick easily, because when you look at the profile, majority of people who are affected are people who are elderly, people who have pre-existing conditions, people who have conditions like diabetes, sickle cell anemia, high blood pressure, and so on and so forth. And you know that going on, for a riot or going for a walk, it requires a lot of energy. Young people have energy. So this thing may not affect them, a lot. We may not see some of these manifestations a lot. But when you go from the rallies, you go home. You go home to your parents. You go home to people who are older than you. You go home to people who have pre-existing conditions. And we may not link what happens later, to the spread, interpersonal spread, of the virus. And those are things that young people need to be very careful about. We need to be very, very careful about. They need, besides food that is being distributed, we need, face masks also. Face masks should also be distributed in a way that we can sensitize and educate ourselves and take precaution. Precaution is very important. What we are doing is very important, but we need to live. We need to have life to enjoy the fruit of our labor.
That's an excellent point about face masks being, distributed, same as food. But I wanted to ask you, as a medical physiologist, trained, all the hard work, blood, sweat, and tears you put in to becoming a professional, what are your thoughts on the current climate whereby scientific opinion and scientific research is casually jettisoned by lay people, as if the scientists have no idea what they're talking about? That's the current political climate that we're in, because even with the protests that you're seeing now, it's actually flying in the face of months and months of NCDC sensitization. Nobody actually cares. You see this in America with the President of America calling somebody like Anthony Fauci an idiot. What is your take on this current climate where everybody thinks there's some kind of armchair specialist?
Besides being a physiologist, I've worked in science journalism for the whole length of my career. And there's a need for public understanding of science. We had a crisis in the past where a number of major news organizations in the US closed down their science desks. But it's nowadays that things are picking up a little. And you look at the era of COVID-19, you look at the COVID-19 infodemics, you look at the misinformation and so on and so forth, it's related to what we experienced in the past in terms of HIV cure. Those days where people in Zaire, in Kenya, Medical Research Institute comes out and say they had a cure, for HIV. And a number of people are believing them. Nowadays, we have a situation whereby, the belief system, it still has a lot of impact on, the response, of individuals. I've met people who say that, look, the virus does not exist. It's just a kind of a propaganda, by the US and other developed countries and so on and so forth. And you look at the pathetic situation of a so-called world leader, attacking science because of political situation, because of politics and so on and so forth. It's the individual that need to really look at issues, how it affects them personally. Because you can't depend on anyone. You can't depend on government. When it comes to personal hygiene, you can't, depends on any other person. When you understand the science, what WHO says, the WHO is still a leader when it comes to protecting our health and so on and so forth. So we need to look at what are the facts. And when you want to get the facts, you look at major agencies like the WHO, Nigeria Institute of Medical Research, NCDC, and what they say is based on science. And if you don't follow those things, you'll be on your own. So for me, the public need to understand what science says. And science is not something you just wake up and say, yes, I saw a vision, this has happened. It's something that you need to work on in the laboratory. It's something, I mean, this is high-tech, science. In Nigeria, we have a national vaccine plan. As far back as 2001, which I used to be part of that process in those days, we have all those protocols, all those initiatives all over the country. We have virologists who have spoken, Professor Wale Tomori, Oyewale Tomori, has said a number of things about what is going on, but who is listening? Young people need to listen to this. Young people need to be the propagator of the positive information through their social media handle. The media is doing a lot that it can do, but we need a collaborative effort in terms of scientists who have the information, medical experts, medical scientists who have the information to provide that information, not to be media shy, but to provide in a way that we all understand the nitty-gritty and we start the process of our behavior change. That is very essential.
Right. I've got two quick questions for you. I'd like to know your reaction. One, to all of a sudden, we said the cases were trending down for COVID-19, and all of a sudden, in one fell swoop, over 181 students in one school down with COVID. What's your reaction to that? And secondly, in Abuja, they said COVID-19 restrictions says people shouldn't protest. What's your reaction to those two events?
Well, there are examples from elsewhere. I mean, in schools, there are protocols, for opening schools. There are protocols on what to do. And you remember in those days, we used to have sanitation corner where there is a bowl, there is water, there is soap, there is a napkin for you to wash your hand and, prevent yourself of any infection. When you go to the toilet, before you go back to your classroom, in primary school, you do all those, I say rituals in a way that you protect yourself. How come we've forgotten some of these things is an indication of our educational system, the challenge that we have. So 181 students, in one school and teachers, is very sad. What are we doing about it? What are we going to do about it? And these are challenges that we need to critically look at. These children are more or less the educators of tomorrow. These children are the ones that will educate, their parents. And I've had families where children, kind of go against their parents. When you bring in any visitor to your house, that you don't know that we are not supposed to be doing all these things. So they are aware. The children are aware. But how did they get exposed? That needs to be investigated so that we can, other people from getting infected. And your second question?
The Abuja COVID-19 restrictions on protests.
The restriction. Yeah, the restriction. The key thing is this. Are we providing our young people with masks? Do they have sanitizers? When we had restriction before, we were told your sanitizer and so on and so forth. So we can't hide under. It's a wholesome response that we should have. Not saying that, because of this, we are going to do this and not the other. And that's why I said, do we really have leaders or rulers? So you don't dictate in a situation like this. We need to all come together to address the situation that affects all of us. And it affects everybody. It affects everybody. 3 days ago, I spent 12 hours to go from one end of Lagos to another. And it affects virtually everybody. Roads are locked down and so on and so forth. But we need to dialogue. We need to discuss in a way that at the end of the day, it will be a win-win situation for everybody. That is necessary. Unless we do that, we just continue rigmaroling, in a way that it will not benefit anyone at the end of the day.
Well, you talked about lessons from elsewhere. And one of the things we've seen elsewhere is that naturally, human beings don't want to be restricted. They don't want to follow guidelines. Look at the UK at the moment. People in Northeast England and Liverpool and Merseyside, they're all saying, they don't want these restrictions. But in other places, they impose sanctions. If you don't follow the guidelines, in France, for example, you pay a certain amount. And some Nigerians have been advocating that perhaps to prevent this public health crisis, that we don't know even the end of it, maybe Nigerian government at the federal and state levels will need to impose very serious sanctions, maybe a fine on Nigerians who do not follow the protocols. Do you think there is still an opportunity for that, or we've already missed the opportunity to do that, and we just allow herd immunity to take effect?
We are quick to have interdiction. Arrest, 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 prosecute, prosecute, prosecute. Where is our welfare system? Does the government speak for us? How do we address issues that concern individuals? The welfare system. When we started, the first thing we did was palliative. Palliative, 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 palliative. And palliative came with corruption, 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 corruption. Where has it ended? The key thing is this. People need to listen. I will support some form of, fine, that will need to be addressed. But how do we ensure that people are not badly affected? Because the situation is very bad already. And means of livelihood is being affected. What are the social welfare system, that we put in place? And if we've not done that, interdiction will be something that, should be the last thing we should do. Because at the end of the day, if I'm infected, the bulk of taking care of myself lies with me and my family. So how do we ensure that there's fairness? Even if we say, okay, arrest, pay, fine, and so on and so forth, how do we address those things? There has been a number of stories in terms of, restriction, there are about 3 categories and so on and so forth, the rich, the well-to-do, those who you can just, those who are below poverty level and so on and so forth. There have been reports that people are still traveling even when the country was locked down and so on and so forth. So you look at all these things, these inequalities, are issues that need to be addressed in a way that we can, critically address our situation. Yes, some form of fine, but our welfare system needs to improve. People are suffering. How do we address it? And this suffering has started way back in the 80s. Because these are the things that we know. In the 80s, the SAP and other measures and so on and so forth. So who has done well among our rulers, our leaders? And those are issues that we need to really look at. We need to sit down. Where are we going as a country? Some countries have done well in what they do, but we need to be very careful. And individuals need to speak for themselves. When you go out from the rallies, before you enter your house, wash your hand. Those are issues that people taking addressed in the past during the high in the middle of the crisis, which we are still in, both pandemic and also the NSAS. So we need to take precaution. You get home, use your sanitizer, wash your hand, take a shower before you interact with anybody. Don't go home and go and hug your parents and so on and so forth. These are issues that we need to really, really be careful about. Because when things happen, no government will come to your aid. And that is very critical for us to take note of.
Which leads me to my next question about Budget 2021. One would have hoped that having experienced this global pandemic, it would actually reflect a new priority being given to the health sector. But as usual, the provisions for help fall far short of the 2001 Abuja Declaration. So the government allocated, obviously the budget has not been passed, but the allocation right now is around, I'm rounding up, 547 billion naira, which is just 7% of the budget, as opposed to the 15% the Nigerian government agreed to, which other African countries have managed to reach. We have failed. We've never reached that. And it works out to 380 billion naira on recurrent expenditure, including salaries, logistics, and equipment. 132 billion naira on capital projects, 35 billion naira on basic health provision fund. Again, I'm rounding up. It now is an average of, and this is precise, this figure, 2,735 naira per Nigerian. 2,735 naira per Nigerian for 1 year is what our government is proposing for health. I'd like your comment on that.
You know, when it comes to health, out-of-pocket expenses is usually what we depend on. And you realize that we had this agreement as far back as 2001, 19 years ago. And this has been an issue that, has been continuous, over the years. So it's an indication that your health is in your own hands. And this is one of the things that we should agitate for, even in the NSAS protest, in a way that who is taking care of us in terms of our healthcare system.
Hello, Akin Jimoh, are you still with us? Hello? Wow, we lost connection there, both audio and visual. Well, I think he's made the point. Nigerians need to take responsibility, even when they go out there to protest. Well, Akin Jimoh, are you back with us?
Okay.
Hello? Are you back with us?
Yeah.
Can you hear me?
We need to take responsibility.
Yes.
I'm back. Yes, I can hear you. I can hear you. Okay. I went off
Please
a little.
go ahead. Yeah.
So we need to take care of our own health. I can give various examples. In 2006, I had a major accident. I had compound fracture. Spent 2 months in the hospital. Spent another 1 month at home. But I came out. I spent my own money. And at the end of the day, you realize that when things happen, you are lying down on your hospital bed. What happens? The other thing is, are we all fit? Because ever since that 2006, I don't spend money on buying drugs and I don't take drugs because I've taken care of my health. WHO says everyone should do like 30 minutes exercise every day. How many are doing that? So when you look at budget and all the other things, what has the budget done for all of us? And those are things we need to critically review. Because it becomes very personal to me. And everyone needs to look at, okay, what are the challenges I may face? What are the precautions I need to take? While we continue agitating for improvement and improved allocation to healthcare system, when we continue looking at, the primary healthcare system, the secondary, the tertiary, in a way that at the end of the day, every level of government address the needs of, that community. And the other thing is 2,000 something per individual does not treat malaria. And that has been an issue that has been there for quite some time. Your medical allowance or your medical whatever in your work, especially a number of media organizations in the past, what is allocated to you for health insurance, in 1 year does not treat you for malaria. And those are issues that we need to really look at. It's the same in a lot of other organizations. So how can we improve what we have at the moment? We had the opportunity when we were pumping money in COVID-19, to upgrade our healthcare system, but it seems we didn't do that. Now, what are we going to do? We need to agitate, for government to ensure that our healthcare system, improves, to agitate that our healthcare system becomes, a system that is at par with what goes on in other parts of the world. And this is very necessary in everything we do. Unless we do that, we'll continue agitating, but we'll continue dying also. We have no choice than to call on government to do the needful.
Well, thank you very much, Akin Jimoh. We hope that the authorities are listening to you and that the protesters and all Nigerians understand the point about taking responsibility. Thank you very much for joining us on the morning show.